Okay, now let's get started. We're excited that you've joined us this afternoon and welcome to our report launch webinar and virtual panel discussion for well-being in rural California 2023. My name is Vicki and I work with Measure of America. And before I turn things over to Lisa Hazawa, Regional Vice President for Western Region of NeighborWorks America, to provide our welcoming remarks, I just want to review a few housekeeping items. Today's webinar and discussion is scheduled for 90 minutes. We will end at 12:30 p.m. Pacific time. And again, the session is being recorded. The audience lines are in listen-only mode. However, we do encourage you to submit questions to speakers throughout the session. You can do so by using the chat function at the bottom of your screen, and our speakers will address as many questions as time permits. Just want to make sure, I know we're still letting folks in. Is Lisa here? Alex, are you seeing Lisa in view? Okay, I don't see Lisa, so I'm going to turn things over actually to Kristen, and we'll come back to have some remarks from Lisa when she's able to join.
Okay, great. Well, first of all, I'm Kristen Lewis. I'm the Director of Measure of America, and I'm so excited to talk today about this new report we have on rural California. And I'm very grateful to all of you for taking the time out of your day to join us. Here we go. Just what we'll do today, Lisa will join us. Actually, Lisa is now in the waiting room. Should I just hand it over to her?
Yes.
Okay.
Hi, Lisa, I know you just logged in, and we're going to turn things over to you for our welcoming remarks. Just getting started.
Great, thanks. Good morning, everyone. Really happy to be here with all of you. And I'm Lisa Hasegawa. I'm the Regional Vice President for NeighborWorks America, and I'm based in California. And we had a really wonderful opportunity to partner with Vicki and her team to support a research report that looked at rural needs in California. And so really pleased to be here with all of you. And I thank all of my partners for joining today. And I look forward to hearing about all of the good information that's going to be shared today. So thank you very much for being here.
Great. Thanks, Lisa. So what we're going to do today is I'll just give you a brief overview of the report's key findings. We'll open it up for questions about the report. Then my colleague Alex will introduce our terrific panel. We'll have what promises to be a very interesting and exciting panel discussion. And then I'll conclude, and I promise we'll have you out of here on time. And of course, I want to thank Lisa and NeighborWorks America more broadly for supporting this research and supporting this work and being such a enthusiastic and wonderful partner throughout this process. So first, I'll just tell you a bit about our project. Measure of America is a project of the Social Science Research Council, which is a 100-year-old organization that's dedicated to making social science findings available for the public good. We started the project in 2007 with the idea to introduce to the US an idea that's been very powerful around the world in measuring the way societies progress and measuring well-being of large population groups, which is called the Human Development Approach and Methodology and Index. And I'll tell you about that more in a minute. We've always been quite active in California from the beginning. So we've had 3 reports in California. We've done lots of reports on different counties and metro areas. We have 2 online tools in California, one in Santa Barbara, one for the state as a whole, the Latino Power Map. And we've worked with lots of organizations, including United Way and others, on well-being issues, on youth disconnection, and several other things. So our most recent report, and this project I'm going to be talking about today, is part of this. And for 2021-2022, we created a Portrait of California, which was our 3rd regional report, and that report focused on housing. And as part of that overall project, we also did several region-focused reports, one on the San Joaquin Valley, one on the Inland Empire, one on Mendocino County, Del Norte County, and Sonoma County. And then this report, this was the final one we're launching on the rural parts of California. So I mentioned earlier this idea that guides us, which is the human development approach. So human development is an alternative to money metrics like GDP. And it's really about the freedom that people have to decide who to be, what to do, and how to live. So it doesn't measure well-being by asking just how the economy is doing. It really focuses attention on people and how people are doing. So the human development approach was developed at the United Nations in the late 80s. It's been used all around the world. And it measures three basic areas of well-being: a long and healthy life, access to knowledge, and a decent standard of living. So these three areas are the fundamental building blocks of well-being. They're also not contentious areas. I think that most people would agree around the world and in the United States as well, that these three building blocks are fundamental to a life of choice, freedom to decide how to live and what kind of life to live, and sort of who to be in the world. We use these same three areas that the UN Human Development Approach uses: the long and healthy life, access to knowledge, and decent standard of living. But we use different indicators that are more appropriate for a US context. So we look at life expectancy at birth, educational degree attainment, so that's the degree attained by all adults 25 and up, as well as school enrollment for everyone ages 3 to 24. So we get in those critically important preschool years, as well as post-secondary education. And for a decent standard of living, our proxy is median personal earnings. So those are the wages and salaries of all workers age 16 and above. So it doesn't include investments and other things like that. It's not the average, it's the median. So it's really about the typical worker. And we look at individual earnings, not household earnings, because we wanted to be able to disaggregate the well-being of women and men. And so women and men often live together in households. So that's why we're using median personal earnings instead of, again, of household earnings. So we then put these three indicators on a common scale. We add them together, we divide by 3, and we get the Human Development Index score, which is on a scale from 0 to 10, 10 being high, 0 being low. And the reason I'm spending so much time talking about this is how we're measuring well-being for the Portrait of California project overall, for all the work we do, and for this particular report. So of course, the American Human Development Index doesn't say everything about, people's choices and opportunities, but it's the start of a conversation. It's an important summary measure to look at the overall well-being of groups. And then we try, once we have that, to understand why different groups and different places are scoring differently. And so that's probably something we're going to be talking about later today. There are, of course, some important limitations and caveats about this data. So for 2 of the indicators, education and income, we use data from the American Community Survey. And for the life expectancy at birth, we calculate that using data from the California Department of Public Health. Because those are our data sources, we are limited in terms of which groups we can calculate scores for. So you have to be able to self-identify on the survey in order for us to be able to create a score for you. So LGBTQ people, for instance, are not given the opportunity to identify. There are certain smaller groups of critical interest to us, people who are experiencing homelessness, say, foster youth. Again, if you can't identify yourself that way on the survey, then we can't create a score for you. And likewise, that's true if the group is very small. If you're a very small population size, and I know all of you working in rural areas are familiar with this, when a population size is very small, it becomes difficult to be able to say something meaningful with statistics just because the error margins get too high. And our only gender categories are male and female, again, because of the way in which people are able to identify on the survey. So we know that this can be quite difficult to encounter this data. We ourselves are always distressed when we see very low scores. But of course, that's what motivates us to do this work, is to try to contribute to better outcomes for Californians of all, no matter where they're living. And of course, we're very mindful about various critiques of the way data can be used. We still think data are really important, and we think it's important to be able to have some measure to compare different groups of people to see where we are today, so we can chart a course forward. That said, we are aware of the criticisms of data and quite mindful of them. This is the first slide I'll show you. So this is the Human Development Index. Again, that's the summary measure by race, ethnicity, and gender. So what we see is that overall, the score for California as a whole is 5.81, and the score for rural areas is 4.84. So overall, the state is doing better in terms of these basic building blocks of well-being than rural areas are. Rural women score slightly ahead of rural men. Rural women have a score of 4.85, rural men 4.79. And we were only able to calculate rates of the Human Development Index score for white and Latino rural residents. Again, the other groups were too small to calculate the rate when we looked just not at California as a whole, for which we have calculated Human Development Index scores for many groups, but for the rural population, we were only able to do that for white and Latino rural residents. The Human Development Index score for rural whites is 5.45, and for rural Latino, it's 3.89. So we see quite a big difference there, especially between whites and Latinos, and between the state as a whole and rural residents. Here we've just disaggregated further to look at white men, women, Latina women, and Latino men. Rural white men have the highest score, 5.51, followed closely by rural white women. Rural Latina women scoring 3.90, and rural Latino men 3.77.
I need to make sure I'm on mute.
This has an asterisk on it because some of the educational indicators for rural Latino men are have a high error margin, but we did nonetheless want to include the score, but with that caveat. And the reason, even though rural women in general do better than rural men, rural white men have very high earnings, much higher than the other groups. And that's what's kind of pulling them ahead of women and of Latino men. Here we have, of course, the state map. So this is a state map of what are called PUMAs. We call them neighborhood clusters. It's a designation called public use microdata areas, and it's defined by the Census Bureau. There are 265, something like that, of these in the state of California, of these geographies. They're created by the Census Bureau to have at least 100,000. They have at least 100,000 residents. So it's kind of comparing apples to apples. And so of the clusters that are rural, by our definition, the high is 6.79, and that's in Sonoma County. And the low is 3.41, just sort of in the western part of Fresno. So that range is more narrow than the range for the state as a whole, but it's important as sort of guideposts for what's happening in rural areas. And on this map and in all of our maps, the darker colors represent for more of something. So in this map, the darker colors are the higher scoring areas and the lighter colors are the lower scoring areas. And in California as a whole, the range is, the low is 1.98 and the high is close to 10. And here we have the rates by rural census tract. So we did it two ways. We calculated the rates by PUMA, by public use microdata area, and also by census tract. And so here the gray areas are the non-rural census tracts, or their areas for which we don't have data. The high is in San Mateo County, census tract there. And the low is in Fresno County, Mendota, Fresno County. So the range is 1.79 to 8.47. The range is always greater in smaller areas because the average, they can be more extreme. In a bigger area, the averages tend to bring things more to the middle. So this is for the state as a whole. And now I'm going to show you a few slides that just show where the highs and lows are concentrated in the state as a whole. So imagine the whole California map here. These are the parts of rural California with the highest scores, the census tracts with the highest scores. They tend to be on the coast, and they also tend to be within a 2-hour drive of a major metropolitan area. So these are places where people might have vacation homes, where people can maybe commute a few days a week into a city. And so those are the areas, the rural census tracts that tend to have the highest scores. Here is the sort of next group. Basically, we just put the full range, which divided it equally into five groups, each being about a 1.3 point kind of range. So this is the next group. So we're seeing more inland, more Central Valley communities here than we saw in the next one. The same is true here. These are the areas with a more middle range. The areas that are starting to struggle are in the Central Valley and the Inland Empire. And that's very true here. We see that some of the lowest scoring rural areas are in the Inland Empire. So that was all the whole index, the combination of health, education, and earnings. And now I'll just talk about each of the components of the index really briefly. So here we have a line of life expectancy at birth. So on the top line, we see women and men, rural women and rural men, as well as rural California and California as a whole. And we see that rural women live 82.3 years. A baby born today who's female, who's in rural California, can expect to live 82.3 years. A man, much less, 77.5 years. And we do see this gender gap of varying sizes in most populations that we look at. California as a whole is 81.1 years, and rural California is 79.8 years. And then if we look below, we see the index by race and ethnicity and gender altogether. And so we see that Latina women have the longest life expectancy for those populations for whom we're able to calculate this. And in the state as a whole, Asian women have the longest life expectancy, but Latina women are close behind. And in rural areas, it's Latina women who have the highest score, 83.4 years. White women, 2 years less, 81.2 years. Latino men, 77.9 years. And white men, 76.4 years. So we'll see in the later slide, white men earn the most, but they live the shortest. Latino women live the longest and earn the least of the groups for whom we're able to calculate these statistics. This phenomenon of Latinos living longer than white residents is something we see all over the country, in California and elsewhere. It's known as the Latino health paradox. Most places around the world, populations with higher incomes and more education tend to live longer. Whereas, as you'll see with our next slides, in California and in the United States as a whole, Latinos have some of the lowest earnings and have less formal education, age 25 and above. And again, that's because of the opportunities people had in their country of origin for Latinos who are immigrants. And nonetheless, Latinos have the second longest life expectancy in California as a whole, and in rural areas, the longest life expectancy. So that was health. Now I'm going to talk about access to knowledge. If we look at rural California, we see that among adults 25 and older, among the Latino population, 63% have at least a high school diploma or higher, and 93% of white residents have at least a high school diploma. And again, that's because the majority of, not all, but the majority of Latino residents of California trace their origins to Mexico. And this reflects the kind of educational opportunities they had. And a lot of times they were not that great, which is why, of course, they chose to come to the United States. And what we see is the second generation has the same kind of, at least high school outcomes as the population as a whole. So like all immigrant stories in the US, a lot of times the first generation maybe is struggling in terms of education, but their children and grandchildren quickly have the same kind of levels of educational attainment. Rural white women have the highest education index. And again, the index is made up of at least high school, at least college, at least a graduate degree, and the school enrollment for everyone ages 3 to 24. So rural white women have the highest index, 5.43, followed by rural white men, Latino women, and then rural Latino men have the lowest score in this area. And last but not least is a decent standard of living. So again, those are the wages and salaries of all adults age 16 and above. And we see that earnings in rural California are about $39,900, whereas in California as a whole, they're $41,900. So that's a significant difference in rural California in terms of how much money people are able to make. If we look at the demographics, we see that white men earn the most, $51,300 in rural areas. So that's higher than the state average, or the state median rather. And Latino women earn the least, $21,900 per year. And those are reflected not in the state as a whole. That's about the same as the state as a whole in terms of which groups earn the most and the least. And in all racial and ethnic groups in California and in the country as a whole, actually, men earn more than women. And the size of the gap varies. So it tends to be the largest among white residents of wherever we're looking at, because again, the outside earnings of white men in particular. So, we are always asking why this is. There are a lot of reasons for the gender earnings gap. One is the field of study. Women tend to study fields that lead to less lucrative career paths compared to men, not all of them, just on average. Then career choice, parenthood, of course, kind of kicks you in the teeth career-wise, particularly if you're a woman. And then the caretaking responsibilities for children and for elderly relatives often falls on women, which impacts their ability to participate in the labor market. And then other things like sexual harassment, wage discrimination, work culture, kind of that demands people kind of be available all the time because of caregiving. Women maybe are less likely to be able to do that. Now, some of this we hope is going to change as a result of COVID. That is one of the very faint silver linings of this terrible pandemic, is that people did become more understanding that people actually have a life outside. The rise of being able to work at home hopefully will help to address some of these gender gaps and these gender differences. And in all of our reports, we always end with a set of recommendations. So I can just say what these are briefly, and we don't kind of just make them up in the lab. We talk to people on the ground. Our different advisory panels inform this, and we also look at important reports from organizations working on this and draw upon those kind of recommendations that they're making. So the whole purpose of the index is that it identifies areas and groups of people who are really struggling using indicators that are comparable with other groups. So in terms of policy, targeting resources toward the most vulnerable populations, as measured by the Human Development Index, is a strong recommendation we make. There are plenty of census tracts where the score is 3 or less. So we would say that those are priority areas for investment. Addressing the health disparities is really important. These were really magnified by COVID-19. They haven't gone away, and they continue to affect communities around the state. Building human security through investments in health education and income. Again, when COVID struck, we really saw how important these investments in systems to help people in difficult times were. And I hope that together we'll learn, because there's going to be another epidemic. There's going to be another catastrophe. It's 100% likely. We don't know what it is yet, but it's coming. And so having invested in systems that help people weather crises that are sudden crises like the pandemic, ongoing crises like unemployment or discrimination are critically important. Investing in the care and education of our youngest residents is tremendously important, as is supporting diverse pathways to careers for kids who are maybe in the 16 to 24-year-old range, emerging adulthood. It's a very critical time. We advocate investing in high-speed broadband as a public utility akin to electricity. It's no longer this kind of luxury item. We could, again, really see during the pandemic how critical a lifeline high-speed broadband became. And we know that in rural areas in California, many are really struggling with broadband, with cell service, with all of the ways to connect. I know California has some big and important strides they're making forward in terms of addressing that, which is great. But ensuring that that happens with equity for low-income residents of rural areas is critically important. Farm workers and the needs of farm workers. We have a section in the report. Farm workers have long worked incredibly difficult jobs for inadequate wages with inadequate protections, and continue to need much better policymaking to ensure their well-being. Closing the gender and racial wage gap is obviously critical, as is increasing the quality and the quality of housing, and that includes on Native American lands. And there are some specific recommendations some groups have made about that we tried to incorporate into this report. So that's all for me in terms of just the overall report, and we're happy to open it up to questions now. And I think, Vicki, I'm going to stop sharing, okay, so people can see one another. Does that make sense? Okay. Okay, I think there's one question in the chat. Okay. So feel free to yell out your question or to type it into the chat.
So, Kristen, the Latino paradox, that was interesting. That even though their incomes are lowered, education is lowered, but they live longer. So is there a reason why? Or...
Sure, so this is such a fascinating question, and it's intrigued many researchers, and there are lots of theories as to why this is. So one theory is called the healthy migrant theory, that only people who are already in good health would contemplate the rigors of moving to another country and starting a new life, so that the population itself is healthier. But there have been lots of arguments against this, and some research has argued that they've disproved this. Then there is this what's called the salmon hypothesis, which is that when people who still have connections in their home country become ill, they go home to be cared for by relatives, or if they feel that the end of their life is approaching, maybe they go home to die. So then their deaths are not counted, and so that's leading to an inflated life expectancy. Mm-hmm. Both of these theories have been, I wouldn't say completely disproved, but there's lots of evidence against them as well. It seems like the strongest contenders are this idea that Latino culture has culturally protective qualities in terms of family cohesion and social support. And a lot of the best evidence comes from maternal and child health, where Latina women have very positive birth outcomes overall. And researchers have said that is because pregnant women in Latina cultures are generally well cared for. People know what they need and really rally around to offer a lot of social support. So it's quite possible that that kind of benefit seen it's kind of applying to everybody in a sense. And so family cohesion, social support is a kind of the leading hypothesis, I think, to explain that.
It is interesting. You identify in your report that they have high levels of diabetes. number one diagnosed among the Latino community.
Yeah.
And hypertension. So those factors are there, but yet they're able to live longer.
Yeah.
So, but it makes sense what you're saying. Latino communities tend to take care of their elderly. You know, if they're sick, they don't take them to the hospital. I mean, they don't take them to convalescent hospitals. They stay home and take care of them. So that actually prolongs their life expectancy as well.
And
But-
Latinos have lower smoking rates than white residents overall. So that's also an important factor, because smoking is still the leading preventable cause of death in the United States. One thing is that the longer Latinos live in the United States, the worse their health gets. So, because your diets change and sedentary lifestyles maybe become more common. Also, people are working extremely hard and maybe have less time to be able to exercise. Maybe they are living in a neighborhood that doesn't have the amenities that are conducive toward, jogging or walking, being outside. Maybe they don't live near so many parks. So there are lots of factors why living in the US is affecting the health of people who are low income in particular.
Thank you.
Kristen, I could imagine that some of our urban friends might say that the measure of median income without any adjustments for local cost of living would somehow skew the HDI. And what is there an answer to that?
Sure. So there are two answers to it. We never adjust for cost of living. We do use cost of living measures alongside, like, for instance, United Ways of California has their new real cost measure report that's out that does a great job of seeing if in different parts of California how much it actually takes to support yourself and your family. So, and that's an important resource that we know is out there. We know and encourage people to use. But in terms of adjusting for cost of living, there are two reasons we don't do it. One is that there's not a great methodology out there for doing it. There are methodologies that allow you to adjust, but a lot of times the geography is so big. So there's, I say, like one adjustment for all of LA County, but the cost of living is really different in different parts of LA County because it's largely driven by real estate costs. Like that's most people's biggest cost. And so, if you're going to live in Beverly Hills, you're going to be spending a lot of money on housing. So the adjustment is too kind of big in a sense, and it kind of flattens all kinds of important nuance. The second reason is, in a way, you're adjusting for the differences that money can buy in terms of well-being. I mean, certain places cost more to live because they're closer to employment. They have better education systems. They have better transportation systems. They're near the beach, or they have a great view. There are lots of reasons why some areas cost more to live than other areas. Otherwise, nobody would live in California. Everybody would move to, like, I don't know, some very snowy place in Michigan because it's a lower cost of living. But there are reasons that doesn't happen. As my aunt who lives in California says, sunshine is expensive. So when you adjust for cost of living, you're kind of acting as though all places are exactly the same in terms of the resources and opportunities they have there. Kind of a long answer. Yeah.
Thank you.
I think there's kind of a myth, though, that in rural areas, things are so much less expensive, you don't really need to make as much money. But in fact, housing is also expensive in rural areas, and there's also a housing shortage in rural areas. And people struggle to be able to afford it. So I don't think that holds water, that idea.
Kristen, I think there's a question in the chat there. I'll just read
okay.
it.
Oh, yes.
It says, is there any empirical evidence of the COVID-19 positive impacts on women's wages or the workplace?
So there is not yet. I mean, there might be some. There's not some that I've seen yet. We're looking for it. There's a lot of empirical evidence on the negative impacts in terms of women leaving the workforce, things like that, especially during COVID, women were primarily the ones to leave the workforce to care for family members. So there's lots of empirical evidence about the negative. I'm hoping, just from an anecdotal standpoint, the fact that people did their job, you could see them on Zoom, there are kids walking behind them, that this is creating space for a different understanding of work, a more flexible understanding that makes it possible for women and men alike to care for the people in their lives. So this was just me being hopeful. I'm usually very doom and gloom with my numbers. So I was just trying to say maybe things could be changing for the better in this area, but I don't know if that's actually true or if it's just my hope.
Abigail?
Abigail,
Hi, can you hear me okay?
we can, yeah.
Okay, hi, I'm Abby. I am with CCRH. I thank you for this report. I think it's great. I'm curious, since there's so much focus on like the length of life being a metric towards sort of this like these great outcomes that we're hoping for. There's a recommendation on like supporting youth, but I'm wondering why there was not maybe like included recommendations on supporting like people into longer lives, or like what you may think like elderly housing and support might look like.
Yeah, that's a great question. I mean, I think that the recommendations about investing in health in sort of systems that build human security applies to everyone, but we did not look particularly at rural elderly people. And the population in many rural places is disproportionately elderly in certain parts of the country and states. So that's something actually we should really consider adding, or maybe looking at specifically and having some kind of brief that can go alongside this report that looks at that in particular. If that's something you want to work on with us, just let me know, and we're happy to do that.
Kirsten, in terms of this report, who is it distributed to? I mean, you're sending this to politicians, municipalities? I mean, you actually, in terms of the farm worker conditions in rural areas, you nail it. I mean, that's the same thing. We're facing all those things that you mentioned in your report. So how will you expose this report to? Is it up to us? Can we distribute to our local politicians?
So twofold. One, we hope that all of you who think the report is worthwhile distribute it to everyone we know, everyone you know, or everyone you think can use it. We often work with our colleagues at United Way of California, and they help us a lot by making it available and sort of telling all of their chapters about it. And they have a lot of links to state policymakers. And we've also recently created links with 2 legislative offices in Sacramento. One, my colleague is going to type them, who they are, into the chat. But one is like the Congressional Budget Office for California, and the other is a state legislative kind of research arm. And they both are going to put this, they're going to include this in their newsletter and share with all of the people who they work with about these 2 new resources for California. And if any of you has any good ideas for how we can do this, we are all ears. If you can think of an event, for instance, where a presentation of this report or these findings would be useful, we are happy to show up there with our PowerPoints, or any kind of place we might be able to write something, or any website where we could cross post. We would love to hear about this, about those chances. Yeah.
And then I would just add, Pedro, that the reason why we felt we were connected with Measure of America and this team was because of NeighborWorks's membership in Philanthropy California and Northern California Grantmakers, Southern California Grantmakers, Inland Empire Funders Alliance. all of these groups are part of Philanthropy California. And so the philanthropic network in California was very involved in the larger reports that were shared at the beginning of the presentation. And so, when they approached NeighborWorks, the interest was, our interest was because housing was going to be included as an indicator for the very first time. And because a lot of the larger statewide reports were already being done, we felt like our value add could be to do this rural slice of the data. And I know that, we have a lot of rural members at NeighborWorks. We have 21 groups, and many of them are working in rural areas, Pedro, like yourself. And so, we're really committed, since we were the funders of this report, to be able to do some additional rollouts with Philanthropy California. I'm really glad that CRHC is on the line. We engaged them early on to make sure that this was going to be and I know that a lot of you are also involved with them, that this was going to be useful for all of you. So, I think that for the NeighborWorks folks on the phone and RCAC and others, if we want to collaborate in thinking about how to really get this out to a wider audience, that's the conversation we wanted to have here today, right? To really think about who needs to hear this, what is your reaction to this, and how is it useful? And I'm all ears as well, because I think we could also support the additional rollout.
And last but not least, we also try to work with media as much as we can in order to get the messages of the report out there. And then sometimes somebody might see it. And yeah, that's just we don't depend on that as our main avenue, but sometimes it can be very helpful that people read about this idea or they hear about it on the radio and then they find the report and can use it. So that's also something we do, though the most important is this kind of targeted outreach to people who can actually surely use the report. I don't see any other questions, though. If you, Dave, last one. Yeah, are there any new ones? Yeah, so Dave Sheldon from United Way is asking, since they apply to poor urban areas, are there particular nuances to them that apply to rural areas only? I would say with the recommendations, the broad way in which we've described the recommendation apply to the state as a whole in poor urban areas, like building, investing in systems for greater human security. But what that looks like in rural areas and urban areas is a bit different. And we've tried to kind of go into those differences in the report. So I think that everyone should feel free to ask more questions in the chat, and we can answer them as they come up. But I think it might be a good idea to turn it over to the panel discussion now, so we have a bit more time for that really important element. So I'm going to turn it over to my colleague Alex to introduce the panelists.
Thanks, Kristen, and thanks everyone.
Yeah.
So I'm Alex. A big thank you to our moderator and all the panelists for taking the time out of their busy schedules to share their expertise during this session. So today we're joined by first Tom Collishaw, President and CEO of Self-Help Enterprises, a multifaceted housing and community development nonprofit serving the San Joaquin Valley of California since 1965. Collishaw is routinely sought out for input on legislative matters related to housing at both the state and national levels. He serves in leadership roles on the boards of the California Coalition for Rural Housing, National Rural Housing Coalition, National Farm Worker Housing Directors Association, and the National Rural Self-Help Housing Association. As president and CEO, Collishaw works with Self-Help Enterprises, the oldest and largest self-help housing organization in the country. Historically, Self-Help Enterprises has developed and improved housing for farm workers and their families as its core constituency. In recent years, the organization has expanded its services to a variety of other special needs groups, including seniors, Native Americans, people with mental health challenges, veterans, and homeless. Next, we have Shauna O'Shaughnessy. Sorry if I mispronounced that. President and CEO of Community Housing Improvement Program. Shauna has been a passionate and effective affordable housing leader for over 2 decades. She's committed to the belief that everyone deserves the comfort, independence, and peace of mind found in a safe and affordable home. In 2019, Shauna took on the role of president and CEO with Community Housing Improvement Program, CHIP, an affordable housing developer that builds both rental and homeownership housing in 7 Northern California counties. Her previous experience includes overseeing community development programs to expand affordable housing options for low-income families in South San Francisco and scaling home rehabilitation and affordable housing preservation programs in San Mateo County and the Western United States, with Rebuilding Together Peninsula and Rebuilding Together Incorporated. We have Pedro S.G. Rodriguez, who's the executive director of the Coachella Valley Housing Coalition. He has over 27 years of experience in the affordable housing field. He was appointed executive director in January 2022, served as the interim executive director for 6 months in 2021, as the chief financial officer for 25 years. He has a deep understanding of the complexities of managing a nonprofit community development organization, both administratively and financially. Pedro understands the development process for both single family and multifamily, and has full knowledge of the asset and property management needs of multifamily projects. During his tenure as CFO, he supervised the finance and asset management departments and was responsible for the banking relationships of the organization. During his teenage years, Pedro worked as a farm worker picking various crops that grow in the Coachella Valley. And last but not least, we have our moderator, Sarah Kakar, director of the Rural Initiative with NeighborWorks America. Ms. Kakar is a communicator, connector, organizer, and facilitator with 20 plus years of experience who enjoys creating opportunities for knowledge sharing, inspiring locally driven planning processes, and providing focused guidance for strategic efforts. She's worked in local government, private, and nonprofit sectors, and is a leader in working collaboratively in developing interpersonal networks across business lines, organizations, and agencies. Her project work experience includes strategic facilitation, national level rural programmatic design, and local level technical assistance in diverse areas, including rural community, housing, economic development, military encroachment, opportunity zones, and revitalization planning. In more urban settings, she's developed strategic revitalization plans for economically underserved communities and brownfield sites. And I'd like to turn things over to Sarah, our moderator. Thank you, everyone.
Thank you, Alex. Well, I'm fortunate to be moderating our discussion today with such an esteemed panel of my colleagues. Our discussion will focus on what it will take to advance equity and improve well-being for all California rural communities. So to start the conversation, I will provide the panelists some questions while also encouraging you, our audience members, to submit your questions for the panelists in the Q&A box during our discussion. So let's begin. Now, panelists, I invite you all to weigh in on this first question. What are the implications of this report on your work? Shauna, why don't you start us out?
Thanks, Sarah. I was super excited to read this report. I loved the framework of the Human Development Index. I'm shocked to hear it's been around for so long, but loved how it framed a more holistic approach to the needs in the community. And it was really impressed upon me how many of the counties that we serve that score so poorly. So we serve Shasta, Tehama, Butte, Glenn, Colusa, Yuba counties. So we're the far North Valley, north of Sacramento, and that kind of still ag area. And it felt to me, and Pedro's question about how are we getting this out, I really resonated with me because when I read through the report, I was thinking, we really need to share this message with our elected officials, because I think that there's an understanding of poverty in rural America, in rural California, but it is not, it's just different than in urban regions. And I think Dave, the second question, your question in the chat, the second question that will be asked, we'll touch on that, because I was also thinking about that. And I dug into the urban stats versus the rural stats. And I think that this shows how much our rural communities are struggling and the importance of investing in our communities. And so I think this just helps us tell our story, and that's the greatest implication. And actually, one other was it just reinforced the importance of our investment in resident services in our multifamily, because that crosses over into the support around education and income and job training and all of those things. One more too, on our self-help homeownership side, the stats that we have of primarily helping female-headed households and Latinx families really shows how effective our self-help program is in kind of counteracting some of the issues of poverty and inequality in rural America. And so it was like, yes, we need to keep going with our self-help housing, and we need to do more with our resident services, and we need to use this report to tell our story better.
Thank you, Shauna. Absolutely. I agree that local government partners are so critical, and especially of all of you folks here with your organizations, those partnerships are absolutely essential to moving our projects and work. So thank you. Appreciate that. Tom, do you want to feed in?
Yeah, good points by Shauna, as always. A couple of things that struck me as one, it was just sort of confirmation of things that we've known for and felt and encountered for decades. We've often referred to the San Joaquin Valley, where my organization works, as the Appalachia of the West. And when national policy looks at rural America, they don't tend to look at California. Actually, if you look at a HUD map, there's no rural areas in the San Joaquin Valley because it all says they're metropolitan, and it's just, there's a disconnect where federally we tend to focus on the Deep South and maybe the border regions and colonias. We have those conditions right here in California, and it helps to reinforce that this report. I think the other thing that I am trying to think about is that we spend a lot of time advocating within California for our fair share of resources, particularly many of us do housing. My organization also does infrastructure development around water and sewer in disadvantaged rural communities. And we always seem to be fighting that fight about why it's critical. We may not have the numbers that you have in the urban areas, but we do have very difficult conditions and people living in poverty, and this kind of an index helps frame that in a more human and different way. And I'm just now thinking about how we can use this in those kinds of advocacy efforts for the California Coalition for Rural Housing and others to advocate for rural resources, because it's a mixed bag when it comes to state resources. The State Water Resources Control Board actually gets it pretty right because they have a disadvantaged community priority and they are directing their resources that way. However, the Housing and Community Development, the department that distributes most of the housing resources, and the Tax Credit Allocation Agency, they are prioritizing what they refer to as high opportunity areas. These are not high opportunity areas, and somehow I think we need to use these kinds of tools to increase and improve our advocacy around those. Thank you.
Excellent. Thank you, Tom. Pedro. You're on mute. It always still has to happen.
I know, it happened to you, now happened.
Yeah.
I think I agree both with Shauna and Tom. It reinforces the things that we already know, right? Especially in our farm worker communities, food insecurities, high prevalence of COVID-19 because they live in overcrowded conditions, inability to social distance, environmental hazards, exposure to pesticides in their work, low wages, lack of access to infrastructure, to water, safe drinking water, lack of access, of course, to affordable housing. I think it's a good report. One of the things that struck me the most, and it's affecting our communities, is that 50% of farm workers are legally here. So I mean, 50% are undocumented, and that's a big thing in our rural communities. And unfortunately, they don't qualify for federally funded programs. And it's a thing that we're trying to fight for them because of that, they live in very substandard conditions, unpermitted mobile home parks, and then most of our, actually, about 50% of our farm workers are in that area. When I look at our waiting list in the rural areas, I know there's a lot of farm workers, but the list is very low because a lot of them unfortunately don't qualify. So I think it was a great report. It opened my eyes, and I agree with Tom. We're going to need to share this report with the local officials, elected both state and local levels, and definitely, bring forth the need to do something about it. Right? We're in the affordable housing business. We are mutual self-help and multifamily apartments. I would love for the undocumented farm workers to be able to live in our apartments. Right, because he also reinforces the things that we're doing. We're bringing in health-related classes to our sites. We're bringing in food distribution. We're bringing in ESL classes for the adults in terms of the education. We have partnered with agencies that provide GE classes so they can get their high school diploma. All those things that we're doing. And the only thing that we need additional funding to be able to provide these services all the time.
Thank you, Pedro. Excellent points. And I think that, well, some of now, as we move to question 2, some of you started hitting on the points that I think will make up question 2. So I'm going to start with you, Tom, on this, and I'll read question 2. The report identifies several areas for investment in action, from dramatically increasing the quality and supply of housing, to ending homelessness, to improving well-being for farm workers, to improving wages, and closing gender and racial wage gaps, just to name a few. Could you pick one of the recommendations from the report and tell us what you think needs to happen to really move the needle on that issue? So Tom, could you start us off on this?
Yeah, the one I picked out, and actually, I think Shauna alluded to this earlier, but investing in the care and education of the youngest rural residents. We have been committed to latchkey type after school programs in all of our rental complexes in rural areas for, well, really decades. And it's such a critical thing for somebody to come home whose parents are probably still working in the fields or at some other low wage job, at 3 o'clock in the afternoon, that they can come someplace that's safe, that can be supervised, that they can get help with their homework, that they can play games, do recreational activities, get on a computer in our computer labs. So we have been committed to that for years. But in this particular, what resonated for me on this particular thing, they're talking about the youngest rural residents. And years ago, we had Head Start programs and migrant Head Start programs in virtually all of our earliest rental complexes in rural towns. And we have only, I think, one left. There's been a disinvestment in Head Start programs, those early, 1 to 5 year old programs that were, I think, really instrumental, and we just don't have the resources to provide those now. And we typically relied on outside partners to do those programs, not ourselves. And so that resonated for me because I think that would be a game changer in many rural communities.
Excellent. Thank you, Tom. Shauna, what's your thought?
I'm so glad that Tom highlighted early childhood education and childcare, because I think that there is a lot of opportunity for partnership. And we've had the same experience with some of the centers that we built in our properties that are closed because the centers can't be run. I wanted to highlight the housing aspect. Tom kind of mentioned a few of these things in his first answer on the implications, but the housing and community development and tax credit program, which are the largest sources of funding for building housing in California, absolutely have an urban bias in the way that the scoring criteria and the competitions happen. And even within the rural set aside, there isn't that adjustment for rural communities that have more wealth. So Sonoma, Napa, Monterey, where they're able to do more local match. The communities, the local jurisdictions have more capacity. There's more local match, and that kind of allows them to be able to build a little bit more. I mean, there's other issues that they face. I'm not saying it's easy for them, but and I think that there really needs to be a clearer understanding of the desperate poverty and lack of resources in our community. And the opportunity maps that Tom alluded to are meant to affirmatively further fair housing, which we are all absolutely supportive of. We want equity. We want our residents to have access to jobs and schools and transportation. But our communities need quality housing, and people are living close to where they work. They're living close to their families. And so there needs to also be a recognition that rural communities, many of them are not going to score well. And there needs to be a different measure for how we're affirmatively furthering fair housing in most of our rural communities. And Dave, I think that, so Dave's question in the chat says, since most of the recommendations probably also apply to poor urban areas, except for farm workers, are there any particular nuances to them which apply to rural areas only? And I would say that there's not necessarily nuances, but it's an understanding that it's a both and, that that we have these same needs in rural communities, and that they're often not seen as being as dire or drastic as they are in urban communities, just because the population numbers are a little bit lower. And rural communities do kind of hide it, or they kind of get by, or they figure things out. You know, they double up, or, you know, family members take care of each other, but they're still needed. And so I think that that's the nuance between the needs in urban communities and rural communities, is that you can't neglect rural communities while serving urban communities. You have to do both. You have to increase the pie that's available so that you can meet the needs of the entire state. So that's my answer to question 2.
Thank you, Shauna. Absolutely. Pedro, do you want to close us out on this question?
Well, since we're also in the housing business, so and one of my things is I'm a developer. I learned from my founding director, John Milling. We want to help low-income people improve their living conditions through the development of affordable housing. And I think that report nailed it when you say public funding and infrastructures is necessary to expand access to affordable housing in rural areas, and that's exactly what we need. We need financing. We need financing to bring in clean water and sewer systems to rural areas so that we can develop affordable housing. Unfortunately, the municipal water agencies, there's a law in California that they cannot use their revenue sources to pay for infrastructure to bring pipelines to areas, so they have to use grant funding. It took almost 20 years for the town of Mecca, and thanks to the state water board and our local politicians, that they were able to secure a $23 million grant that is going to bring in water to those areas, and that will make it more accessible to build affordable housing. The other thing is, we had land for a long time, 60 acres in town of Mecca that we're trying to develop. We had to put a hold because there was lack of domestic water capabilities. So now that we have that opportunity, and it also took grant funding for the water district to be able to treat a well, right? There's high levels of arsenic in that area, and unfortunately, a lot of people that are living in substandard conditions are facing that lack of clean water. So we're going to be able to develop the 60 acres into 291 several homes. However, one of the things that I'm encountering is that the cost of development it's a little high. And I am looking for financial funding from both the federal level and the state level to see if we can subsidize the cost of the land development. And unfortunately, the funding is not there. There is no funding to help rural areas to be able to develop lots at a reasonable cost so that the overall cost of the house will be affordable to families. So that's a big area that we need to push for.
Excellent. Thank you so much, Pedro. So I'm going to move to, these are a little more targeted questions for each of you. And so I'm going to actually start with you, Pedro. I'm going to go backwards from the last order. So while you're still unmuted, how can we ensure that affordable housing initiatives in rural communities are sustainable and provide long-term benefits for low-income residents?
So, as mentioned in that report, there's a lack of infrastructure to build affordable housing. Definitely lack of access to water, storage systems. We need initiatives that will provide funding for the municipal agencies to being able to bring water and sewer systems. We definitely, as you know, Tom and Shauna and us, we're big users of the Mutual Self-Help Program, which is funded by USDA. That's an incredible home ownership program that allows low-income families to participate, build their house, become homeowners, and pay affordable payments for their homes. We need to continue to advocate for that program, and every year, the funding gets reduced, but that is a great program that provides homeownership opportunities to rural areas. We also need to initiatives like Shauna said, at the state level, we need to emphasize that rural areas cannot be looked at as in urban areas, right? We lack access to the amenities that are required to get the points that you need in applications. Somehow we need to come up with an exemption because rural areas are not, close to schools, to pharmacies, groceries, or medical clinics. So I think we're advocating for some sort of exemption to allow us for projects that are going to be developed, especially multifamily projects in rural areas, so they can qualify for funding, so that we're able to build affordable housing in those areas. And the big thing that I'm doing, that I'm pushing with our congressman, is to allow to have federal initiatives that allow undocumented workers with mixed status families to be able to qualify for federally funded programs. We have a lot of undocumented head of the households where their kids are legal. They were born here, but yet they don't qualify for housing for any project. There's the 514, the 516 program, which is for multifamily housing for farm workers. If we will be making a tremendous impact if we have initiatives that will allow them to qualify it and then prorate the benefits, prorate the rental assistance that they get, right? Don't give them full access to the system, but if you got 3 kids out of 5, give them rental assistance for those 3 kids. That will be able to move a lot of people that are living in substandard conditions into safe and decent and high quality housing.
Excellent. Thank you, Pedro. And as I said, we're moving back through the opposite way. So Shauna, how can collaborative efforts between different stakeholders, such as housing developers, local businesses, and residents, be fostered to create sustainable and equitable housing solutions in rural California?
So this is an area that actually there is greater opportunity in rural communities because the ability to access leadership within rural communities it's just easier. I mean, you're able to talk to the city manager, you're able to talk to your elected officials, you're able to connect with business leaders. In our region, because of the Camp Fire and other fires, there has been a shift. So historically in rural communities, they're like across California, but there was an underinvestment in affordable housing because it wasn't at a crisis level. Because of all of the disasters that we've had, we were at the edge of a crisis and we were just pushed over the precipice into absolute crisis. We do not have enough affordable housing, and there was a tremendous loss of any naturally affordable housing that used to be there. And because of that, folks who used to maybe oppose or look askance at the subsidized housing, affordable housing that is, built through mostly government funds, are now saying we need it. How can we get it? What do we need to do to make it happen? And the economic development organizations in our region are also saying housing is absolutely critical to our economic development. And that wasn't something that they ever included in that. So I think that when there is an opportunity like this, we have to take that opportunity and make sure we have a seat at the table, and that we're always making the connection and explaining the continuity of affordable housing, that affordable housing encompasses serving folks who are coming out of homelessness or experiencing homelessness, unsheltered folks, to working class folks that are in moderate wage income, so low wage earners and others, and then retirees. And so what is that? What does a healthy community look like in making the case? So right now is a time, particularly in disaster impacted areas, where there is cross-sector collaboration around housing. And I think that we need to ride that train and make sure that our message is heard, and that it continues into the future when hopefully there's not a crisis anymore.
Yeah,
Someday.
absolutely. Thank you so much, Shauna. And here's the last of the panelist questions before we open it up to some audience Q&A and getting to enter our discussion for the last bit. Tom, how can we use this research and data to help accelerate and foster dialogue about advancing racial equity in systems and policies to address the inequities highlighted in the report?
Yeah, a couple things come to mind, Sarah. And without trying to be too wonky about it, there's been mention of high opportunity mapping, and that's being used pretty much across the span of some important programs for rural California, particularly housing. There has been an acknowledgement by the people who have created those maps and refined those maps that they're imperfect at best for certain rural areas of the state. So they agree with us that they're insufficient, and they say, do you have anything better? I think we ought to give them this index and say, you need to put that into your algorithm when you start looking at high opportunity or opportunity mapping and those kinds of things. Or you need to take places with particularly low scores and hold them harmless and give them the points that you give high opportunity properties. So I think we can advocate for those kinds of things because this is data-based, and they always say, well, it's got to be data-based. Whatever you give us, you can't just tell us, rural areas need more or they have opportunities that are being unrecognized. So I think that's one area. I think we could also use this to do advocacy around increased resources. There's a current conversation going on about the potential of a large housing bond that would go to voters in 2024 in California. And frankly, the initial numbers that are being bandied about are too low for farm workers in rural areas. And so this kind of thing could help. And I think lastly, many of us have some gaps in our resident services. It's been referred to several times by all of the panelists. And I think this is the kind of thing that can be helpful in raising funds from foundations or other sources that might be able to help us provide services that are desperately needed in these rural towns.
Absolutely. Great points, Tom. Thank you. So now I would like to invite you, our audience members, for the last 5+ minutes into this discussion by asking you to add your ideas into the chat box. We've seen some of you asking questions. Thank you so much. And if you could just add some ideas about how you want to build on some of the examples mentioned. So perhaps how do you see your organization and or research fitting into this work that our panelists have been discussing based on the report? What can you or your organization bring to the table here? I know we've got a wide variety of folks here on the line, our audience today, and we'd really love you to sort of throw some of your ideas into the chat and enter into discussion for this last bit with our panelists. I can also put those last questions. I can put those questions in the chat for you because I know I'm gonna Thursday close to the July 4th that it's hard to track all of that. So I'll just put the two questions that I just mentioned there to see if anyone has some thoughts in the audience.
I think we lost Spike. I was going to put him on the spot. Spike was from the FDIC, and
yeah.
I was hoping that we'd be able to maybe collaborate with the FDIC to bring some of this information to his bank agencies, because or his bank members that they oversee. So I was thinking that might be one possibility.
That's great. Thank you, Lisa.
And then
Definitely.
Tom and I have been having a side conversation about an event that's happening right in Fresno with Northern California grant makers. So I do also think that they're aware of Measure of America and their investment in this, but I think that we certainly can do a lot of follow-up. I'm just really pleased. My reflection from your reflection is that, you know, if this was going to be useful, I was hopeful. We weren't sure, you know, how this was going to, I guess, compare to some of the other research that's already been done. You did say that it was confirmation of a lot of what you already see day to day in the work that you all do. But I guess one thing I'm curious about is how you see this as complementary or unique to other research that's out there. I mean, I think you all said that, you know, it needs to get to all these different audiences. We're certainly absolutely, you know, committed as NeighborWorks to help, you know, get this out there. We supported it. This is why we supported it, to, you know, have it be helpful for all of you. You know, we can bring it to banks, we can bring it to foundations, you all can bring it to elected officials. And, you know, I hope that we're able to get some good traction with this report.
So Lisa, can I say something? I think you're one of the things, if I may, Sarah.
Yes, please.
The biggest thing, Lisa, is bringing this type of report to big foundations and showing them that the kind of thing, the plight that the people in the rural community, especially farm workers, are facing, and secure some sort of financing, right, funding to help organizations like us to provide services to them. I mean, a lot of these resident services that we're doing, they're being paid by our general fund, and we need support. You know, we during the COVID pandemic, we realized there was going to be a lot of food insecurities, so we had to partner. We actually partner, and we actually paid to bring in food to our residents. So we brought them in so they can have access to food. A lot of them couldn't leave their places. Health education classes that we're providing. All those after-school programs, as Tom mentioned. We're fortunate that our child care centers that we built in the early apartments are being operated by a nonprofit organization that does child care. One of the things we noticed is school districts were the original providers of the services, and then they say we cannot do it; it's too expensive, don't fund it. So they kind of left, and we're left with the building there. We were fortunate that we found a nonprofit that is operating all of our child care. So we still continue to provide those services, but I think funding is critical. But it needs to come at the high level, big foundations that support the needs of the farm workers or rural communities.
Excellent. Thank you, Pedro. And in the chat, Clancy Taylor noted that working with TCAC, HCD, and SGC to further the case and cause for targeting rural areas with their funding opportunities, because as you all said, the data that this report really elevates just tells you what you already know, but gives you some of that backup about those communities that you serve. So
Yeah,
yeah.
Oh, sorry.
No, please go ahead.
I was just gonna say, you know, Clancy, I think Clancy, we lost Clancy too, but, you know, in the conversations with CCRH, you know, I know that CCRH does a lot of research. And one of the things that they communicated was that they were really glad to have a research report that was by sort of an independent entity that would be seen by legislators and others as more objective, if you will, even if they're looking at the same data, right? So I think that the source was also helpful. At least that was something that they had shared with us. So yeah.
Thank you, Lisa. So we're just coming up to time. We have time for our panelists to share about a minute of their thought on this question. So each of you, what is one thing you hope our webinar participants will take away as a result of today's session? So just a minute max for each of you, if you could give us some closing thoughts before we move to close out today's session. Pedro, do you want to start? Sorry, you're close to me on the Zoom square.
I think, awareness of the plight of people living in rural communities, farm workers specifically, be sensitive to their needs, support advocacy efforts to provide funding to develop infrastructure needed to build affordable housing. I mean, we are capable. We have the expertise. We have USDA who supports, mutual self-help programs. We just need funding for the infrastructure to make them affordable. In order for us to be able to serve lower income people, we need to kind of lower the cost of construction so that we can bring this program to the people at 50% and below. And also funding to bring services, to rural communities. Like I said, we have resident service programs. We need funding to continue bringing the services that nobody else is going to bring to our residents, right? It's up to us to make sure that they're safe and they live a good life. I mean, it's studies shown that if you live in better, spacious housing, that your health, your mental, and everything is impacted. So it's an overall well-being for the families.
Thank you, Pedro. Shauna, one thing.
All right. Most of everything Pedro said, plus that data are important in rural communities, and that we appreciate this report, and that we would appreciate continued research into rural communities.
Excellent. Yeah, absolutely. From someone who works with a lot of rural data in states and at the national level, we can always be using more very excellent quality data. And Tom, one thing you hope the webinar participants will take away from today's session?
Yeah, I would just say that at our core, the three organizations that are represented on this panel, really the most important thing we do is provide opportunity to people to improve their lives, whether that's through housing, to direct services, through empowerment and giving people a vision of a better future to improve the lives for themselves and their families. And so I think additional tools like this that kind of points to the kinds of needs that rural communities has is just really useful and important.
Excellent. Well, thank you for really holding this report to such an esteemed level as it should be. Is it something that using this as a tool is critical? So appreciate that, Tom. Well, I want to say thank you so much to all of our panelists, Pedro, Shauna, and Tom, for the thoughtful and insightful discussion today. And thank you to all of you, our audience, for contributing through the chat and your questions, and really passing along to us some of your collective knowledge and wisdom on this really critical topic. So now I would like to turn it back to Kristen to close up today's program. Kristen?
Great, thank you. Thank you, Sarah. So first, I just want to thank Lisa for her support and partnership throughout this process. I want to thank Tom, Shana, Pedro, and Sarah for a wonderful panel. It was terrific to hear all of your thoughts, and I appreciate all of us on the team, appreciate your kind words. I'd like to thank my team, who of course made today's event and the report happen. And I'd like to thank all of the audience members for taking the time to join us today. So please reach out with any opportunities to present or distribute this report that you see. If there's anyone you think has to have it that we might not know about, please reach out to us and we'll send it to them and give them a briefing or do whatever makes sense. We'd also really like to hear your ideas for further work and research for rural areas. Today, a couple of things did emerge. The special needs of undocumented farm workers, for instance, as well as elderly residents of rural areas. So we'd love to hear more ideas, or we'd love to work in partnership with any of you to look at these issues in greater depth. So on behalf of everyone at the Measure of America team, I'd like to thank you once again. And yeah, have a great rest of your day. Thank you. Bye-bye.